Now, late or relapsed clubfoot. In third world country, it's quite common. And we usually see children with 3 years, 4 years, or 5 years of age coming to your clinic for the very first time with bilateral club feet. So, one is that you have to define the clubfoot very clearly. That if the child did come to you about, let's say, in 1 month or 2 months of age, and you applied Ponseti and got corrected, but later on, because after the from 3 months, if you have corrected all the clubfoot deformity by using a Ponseti method, you have to apply DB splint for up to 3 years, and usually that is the difficult part. Usually parents don't apply because then say as the child starts walking by 1.5 years, they stop applying the DB splint to the shoes. So if the child has taken some treatment and now as recurrence of the treatment has occurred or the recurrence of the pathology has occurred, this is can be termed as a relapsed clubfoot. That is, the child has again come with the same problem despite the treatment failure. Now the late clubfoot is that the child took no treatment for a quite a long time, and now when they've come up probably at 5 years, 10 years, and maybe as late as 18 years of age as well at times. Therefore, they come in the category of late clubfoot or neglected clubfoot. So if a patient is there with the relapsed clubfoot, then you have to understand what is the age of the patient and what was the treatment which was given. If there was a failure of Ponseti treatment and the child is less than, let's say, 1 year and maybe less up to 2 to 3 years of age, when we can go for certain soft tissue procedures. But if there is a failure of treatment and now the child is about 4, 5, or 6 years of age, we will have to go for certain boning procedures such as the medial condom lengthening, lateral condom shortening, and may or may not required Cuboid decancellation. But if it's late clubfoot, for example, this is the situation of a foot which comes to you about, let's say, 10 or 12 years of age, then probably at this age you have to go for certain procedures which is either involves orthodesis. If it's unilateral, you can even go for orthodesis as early as any age after 10 years of age, or you have to go for certain fixators, which is the ring fixator, which may need to be applied. If you see this is a child which has grown up now and it has a bilateral club feet. Now, as I told you, bilateral clubfoot means you cannot go for triple orthodesis in both foot, because that would mean that you have actually reduced the subtalar motion in both feet and the gait would be problematic, and patient will have to use a lot of energy. Expenditure will be there for the patient to actually simply walk, and then walking will also be more of an issue, especially on the uneven surfaces, because when we are walking on uneven surfaces, our hind foot goes into certain supination and inversion movement, so that we can actually, that creates a ground clearance, so we push off becomes very easy. If that is not there, it will be very difficult for that person actually to walk on uneven surfaces. Therefore, then the treatment for bilateral neglected or late clubfoot would be to either go for ring fixator on both feet, that you have applied this as well as this. Then in this, there is no clear-cut guidelines that you go for the treatment of both feet at the same time. What you can do is that you can correct the first foot 3 to 6 months of time, and then you can apply the laser off on the second foot. Or the other method is that you correct this foot in one go by going for triple orthodesis, and you correct this foot gradually by use of laser off method. Then by 6 months of time, both feet are corrected and patient can have some movement on the one foot and no motion at the other foot, because subtalar joint has been orthodesed. This is important, that when we are dealing with the late clubfoot and neglected clubfoot, there is no clear-cut guidelines. That is your own clinical judgment, clinical experience, and then it's your own decision making, whether you want to go for laser off fixator, you want to go for orthodesis, you want to go for supramalleolar osteotomy, or certain other bony procedures to correct the deformity which is present. So if you want to watch those videos, you can go to www.sqadia.com, and we have a new application available as well. That is, you go to Google Play, download the sqadia.com application, and you can watch all those videos online related to orthopedics and all other fields.